Okay, I think we'll go ahead and get started. So, welcome to the May edition of Office Hours. Really happy to present this next topic, and I think you're going to be really interested by it. Again, thanks for taking time out of your day to come and listen. There's some super interesting subjects in here, so please feel free to ask any questions in the chat whilst you're going. If we don't get around to them, please, we will get to them at the end and ask our presenters. So yeah, so today's agenda, Michael and Kristen are going to take you through what kind of metrics you can find in your Luma reports, key metrics to watch, Luma reports demo, how to navigate the Help Center documentation, and how we can use this data, followed by a Q&A. And again, if you do have questions, feel free to put them in the chat, but if we don't get around to them, we will answer them at the end. And just a quick reminder, this call is getting recorded. I'm gonna now hand it over to Michael, and yeah.
Cool. Thank you, Nathan, for the introduction here. So our if you've ever gone into a reporting section, it can be really intimidating because there's kind of a lot happening and broken down into multiple feature areas. We'll go into the product here in a minute or two to kind of explore and discover a little bit what's all about. But you'll really find metrics and graphs and tables around three kind of decision frameworks, right? You'll have your kind of operational data that you can use to make boots on the ground type decisions, right? We're talking about being able to look at your deliverability metrics, to look at how your staff are engaging with message, or if referrals actually get scheduled. I'll step up from there to be a little bit more high level. You will have your sort of tactical data points here. This is where usually we talk about rates, right? We talk about how many appointments were actually got confirmed about all the appointments that you have, these confirmation rates, how many forms were actually completed and finished over that rate. If you do have our self-scheduling product, you can start looking at how many appointments got booked through our self-scheduling product. And if you really want to go a step up and kind of look more strategically and higher level here, this is where we'll talk about more the ROI type of metrics, the metrics that help high level decision makers to understand kind of the value of Luma and how your practice is doing, right? We're talking about your engagement rate. We're talking about your net promoter score if you capture feedback. We're talking about if you are using referral or outreach solution, we can start looking at these conversion rates and see how they kind of move over time. So just wanted to kind of give you a brief overview as when you're looking at these metrics and when you're looking at these dashboards, always ask yourself, what level do I really want to operate and what makes sense versus not. And so again, this was just a couple examples of metrics that we have here in our product. As Nathan said, I will show you the Help Center documentation where you kind of have definitions of all the metrics we have, and kind of pick and choose what you want. So from here, I am gonna take control of the screen to be able to kind of share with you a little bit what it kind of looks like in the product, what are kind of your capabilities, what you can do versus not, and how you can kind of take full advantage of our reporting solution here. So let me take one second here. Cool. Awesome. If you do get into our reporting solution here, so on your left hand side under the reporting section, you will come to a left side menu where you'll be able to look at all the kind of the feature reports available. Let's collapse. If I did it, we'll be able to collapse this. And reload the dashboard here, just so we have the report that kind of maximizes the space on the screen, because you really want to focus here on your dashboard here. You can always come back here and select select the report you want here on the left tail menu. So this is it. Our reporting solution currently is really broken down by kind of the types of features that Luma offers. So obviously, depending on your Luma implementation, you will see more or less your number of reports, right? Some reports may make zero sense to you because you are not using or leveraging the Luma product. But usually you will at least, and that's kind of the ones we're going to go through here, you at least have your core messaging and appointments, kind of the top two here, that if you are a Luma customer, you are probably leveraging these. So your landing here, obviously it can be a lot to digest at first, but the one thing you'll notice is on the top left tile here is always going to be kind of the raw count of whatever feature or metric we're measuring. So in messaging, it's going to be the number of messaging sent. In appointments, it's going to be the total appointments, etc. In referrals, it's going to be the total referrals, etc. The reason for that is obviously it's the most basic metric that you want to track, and it's also a way for you to come and easily download a little bit of that raw data, and I'll show you how you can do this. So in our reporting solution here, every single metric is clickable. What we call at Luma kind of a drill down. So basically it's like, okay, it's great. I have 351 messages sent to patients. And if I click on it, it's going to go back to our data warehouse. It's going to go and grab all the 351 messages that have been sent to patients for the date time selected. It takes a little bit of time because we're kind of churning a lot of data there. So have to be a little bit patient to kind of load that raw data. We're always trying to obviously make better improvements on our performance. And here you are. You're going to be checking at the raw data for all your single for all your messages here. So in here we have kind of a table representation by default. The table is trying to fit the screen. So when you have a lot of columns like here, it may be a little bit tight. So if you prefer a scroll experience, you have the 3 dots here, and you can use on auto size all the columns, and it will kind of fit to screen, and you can scroll horizontally. Usually this is not the best experience. It really gives you a kind of a quick glance at your raw data. But, going and looking at raw data in a tabular format here on the browser is not great. So usually what you can do is you can click on this download button here, and you can come and download data as whatever format makes sense to you. This is, if you are a kind of an Excel junkie and you kind of like, I don't really want these pretty graphs. I really just want to give me the raw data. And after I'll do it myself in Excel because I want to munch the data myself. You can come in and grab that. By default, and I don't have an example here, by default, if you are more on the bigger size, your table here may have a warning on top that says, and I'll show you in the help center what it says. It says row limit reached. If you have more than 500 records, for performance reasons, we don't want to show more than 500 records in the browser because browser capabilities, it may crash the browser, it may slow down your entire system. So we're trying to limit that, but we still want to give you access to all the data, right? We don't want you to have to filter, etc. So this is where this advanced data option comes here. And what you can do is you can usually come here and click on all results or custom. I just want the first 5,000 rows or the first 2,000 rows. If you click on all results, it will again go back to the data warehouse and grab all the data for your messages that is coming here. So if I click download, again, it's going to go to the data warehouse, grab all the results, and come and download this data. And apologies, my connection may be a little bit slow. And I have it here, and you can open it in whatever Explorer you want, whether it's Google Sheets or Excel or whatever you're using to process CSV. I talked a little bit how the filters that you can filter your data. The filters are up here. So every single dashboard will have date type filters and filters for the rest. Date type filters are anything to manage the time frame you want to see the data by. Do I want to see my messages for today, for yesterday? Here I'm seeing for the last year, and it's showing like from what is it, May 26, 2022 to May 26, 2021. Data aggregation applies to these types of graphs that have a temporal axis on the bottom. These types of graphs are kind of what we call trend graphs. So I want to see kind of how my data kind of trends over time. And we give you the possibility of like, well, if I'm looking at today's data, I want to see it trending by hour. If I'm looking at, a past 360 days, I want to see it trending by month. I can also, if I want to have it trending by quarter. So we really allow you to kind of visualize the data, especially for these trend line, kind of aggregated the way you want. So that's why we call it data aggregation. Again, it only really applies to these temporal types of graphs. Again, we'll give it 2 seconds here for this types of, and now you're really seeing the data group by quarter. The 3 vertical dots here allows you to download not the raw data, but the aggregated data. So here I was like, okay, I like this image. I can come here and really download as an image of the visualization. It will kind of open this window, and it will kind of generate that image, and after you'll have a high resolution image for that if you don't want to take a simple screenshot of your screen, right? And you have it available here. Sorry, I'm just sharing my browser, so I'm like, oh, maybe I can open. It will probably not show it won't show because it's not in the browser. Apologies for that. But you'll have a high resolution here image of your screen. This little log function here allows you to save these filters for when you come back. So we have default settings. So the default is always the last 7 days, where the data aggregation is by date, etc. And so that allows you to, I was like, well, I know that every time I come into this report, the one thing I want to do is, look at quarterly data for the past 365 days. And I really don't want to, like, every time I come here, have to go into filters and click and reset that. So we gave that capabilities that is kind of similar to what you see in other filter utilities in the rest of the application. So that it kind of saves with your profile, so you can really keep that for yourself. So yeah, and you can scroll down. So for example, here, a couple of operational metrics, such as as I mentioned, the message deliverability, kind of broken down by categories. So you can start seeing, okay, where do I have bugs? Where do I see that, messages just don't go out? I have my patient engagement rate here. And we'll always have these little info bubbles to tell you a little bit how it's being calculated. And I'll show you for these aggregated metric what kind of the drill down looks like in the appointments dashboard. In this example, we also have a couple, and I think Kristen will talk a little bit more about this specific operational table here that you can use to really troubleshoot your Luma instance. In the and kind of every single dashboard here kind of operates the same way. You have a set of high-level KPIs, a set of graph visualizations, tables and drill downs that really enables you to kind of pick and choose what you want. For these types of aggregated metrics. So for example, I'm looking, for this instance, that I have a 25% appointment reminder response rate. And I was like, well, what does it mean, right? What is behind kind of that metric? So if I click on it here, you won't directly see the raw data. You'll see the numerator and the denominator of that calculation. So for example, here I'm seeing that I have I sent 8 reminders out, and I only received 2 responses back. And so from here, after, I can go and drill down into whichever one I want. So kind of a drill down if you want to really go to the deeper level. So I click here, and this is where I'm going to get the 2 messages that were sent. And again, same thing, same experience. You'll see the table loading. You'll see your two your two responses here that kind of got into that, that contributed to that metric. Yeah, here that is it for this report. Again, same types of experience for referrals. If you depending on how your instance is set up, this dashboard may be called outreach. So that's why sometimes you may see for some of you, you'll see the referral dashboard. For some of you, you'll see the outreach dashboard. The data is kind of presented the same way. The labels are a little bit different. Again, I mention some of the, you have this concept of like conversion rates that are here that can help you, understand kind of where you're standing. If you are using any type of our form solution, whether it's our intake form solution as well as our scheduler or a scheduling form, this is where you'll be able to start looking at your form's performance and understanding how many forms were sent out, how many forms were completed, how many forms were incompleted, and obviously the calculation of this form completion rate. A little nifty feature here on the pre-scheduling form is if you drill down in most of these reports, again, the same type of, the same type of experiences. I was like, okay, these are the 6 patients here. Again, it's all the generated data, so that's why you have Luma test or test or whoever Candace Myers is. Or Stephen, who's one of our product manager here. So let's look at Stephen, right? He came here, he completed his form, and if I scroll all the way to the, I'll have all the information related to that form. And I was like, yeah, okay, this is great. If you kind of see at the end, it's kind of like hidden away, kind of a little bit of an Easter egg here. If you click on it, you can come here and open the actual form instance in the Luma application for this one. We see this is a test, so there's no information here. But again, it really allows you to deep link all the way to the raw data. We're trying to add a little bit more of these types of functionalities throughout our drill downs, so really you can start connecting all the dots. And so yeah, kind of in a nutshell. I know I've kind of been very highly superficial and very quickly over it. Kind of how the reporting solution works. I think the last thing I want to mention is these 3 dots up here. I know there's a lot of menus, right? So as I mentioned, there's again the download functionality here to download the raw data. There is the download data here to kind of download just the aggregated data. So here we'll just download 6 basically. And after the 3 dots here, has another download, and that's where we have kind of the dashboard level download. It's like, okay, Michael, it's great, but I just want to be able to download this dashboard. And there's really 2 ways: as a CSV, so it's going to be a zip file with all the CSVs for all this dashboard. So if I click on download, it will just go back to our engine that's just going to bring everything together, create these CSVs, and it creates, you see the zip file that will just have a list of all the CSVs, but also a visual representation of the entire dashboard. And I was like, okay, I just want to take this dashboard and just dump it somewhere. I can just download that as a PDF. And so if I do open in browser, it will actually open in the browser I'm sharing. We will wait for this to run. And at the end, I know for some of you, you may operate in different time zones. By default, the data is showing in time zone that your account is set up in. But we do know that some of our customers may have facilities in different time zones. So if for whatever reason, you want to filter by a specific facility, and you know that this cardiology care center is in, let's say, by my default here for my account is in Los Angeles, so Pacific time. And let's say my cardiology care center is in Mountain time. I can come here and I can come and select the update the data. And again, it will go back to the data warehouse and do that time zone conversion. It really for edge cases where, kind of, especially if you're grouping by hour, right, where that plus or minus hours actually matters. Most of the analysis doesn't really matter, so we don't really care. But again, we know that sometimes we need to be exact here. So having having that way to troubleshoot and understand what is important. And yeah, just wanted to show here the PDF has been generated, and you have kind of a PDF representation of the entire report. And finally, before moving into on to Kristen to give you a little bit of kind of questions and use cases that can be used, I encourage you to come and check our help center. So if you land into the help center here and you scroll down to our reporting section, you'll be able to see a couple of useful pieces of information that can be useful. Kind of covers a lot that I mentioned today. Kind of what are the different types of reports that we have when you get started, etc. How filters work. But the one article I want to show you that can be your friend, because we may call a KPI or a metric in one way, and we have different representation of what's behind that, right? We may call our confirmation rate and calculate it one way, and you're used to calculate it in another way, right? That's why we kind of always want to give the raw data. So if you calculate it a bit differently, you can build your own. But we need to give you is like, okay, how are we calculated it? And this is where this reporting metrics reference guide that you can find here on the right side of the section, but also in your, move all the Zoom things. Also, click here, you should have the metric reference guide. It's kind of a huge page, but it will really list out all the KPIs that we're surfacing in our products. In our featured reports, right? So I was like, oh well, I want to understand what is appointment books through patients scheduling plus. I know it's accounts, and you always have this table to understand what the date field filters on. Does it filter on when the appointment was created? Does it filter on when the appointment is actually happening, right? Every single type of object could be linked to multiple types of date timestamp. A message can be, well, was it when the message was sent? Was it when the message was delivered versus when the message was received, et cetera, right? So there's always these dates, and we kind of try and did our best to use the one that kind of makes the most sense on the business side, but we wanted to give that visibility in case you wanted to know. And whether the other types of filter kind of applies to that metric. There's some metrics, for example, that it doesn't make sense to filter on provider, right? So you can always go back to reference that if you're using the filter, and I'm saying is like, wait, this metric didn't really update. Is it normal? It's like, oh yeah, well, it's normal because that specific filter doesn't really apply to that metric. So kind of a useful guide. Some metrics that are a little bit confusing or can be very generic. We try to give a little bit more detailed information. But yeah, that is kind of it on a very high level how our reporting solution works. So from here, I will move it over to Kristen, and she's kind of going to walk you through a couple of use cases and kind of what types of questions you may want to answer and how our reporting solution can work. So Kristen, the floor is yours.
Thanks, Michael. All right. So moving on, want to make sure we have time at the end for questions. So I'll kind of move through little parts of this a little bit fast, but it's nothing too complicated, so I think it'll be okay. So how can I use this data? So there's a few main ways that people typically ingest this data and work with it. So probably number one is you want to identify problems as they come up as proactively as possible. If you're making improvement efforts, you want to monitor the success of those improvement efforts. One that I love is estimating the return on investment or time savings that you might be getting out of Luma. And of course, so much more, but we'll go into these main use cases here. So you want to identify problems. So probably one of the main ones, obviously there's a lot of different problems you can identify, is message delivery. So a lot of problems can start, or you want to start your investigation with looking at message delivery rate. So you want to see if you have a low delivery rate. Now, what's a low deliverability rate? That might vary across different populations. So given that some patients, for example, with prepay phones, or if they're in areas with inconsistent cell phone coverage, they may have lower average delivery rates. But it's good to know what a typical rate for your patient population might be. So generally speaking, anything above 90% is going to probably be a good delivery rate. So whenever you're investigating most issues, so such as a drop in your referral conversion rate, maybe a drop in your appointment confirmation rate, or maybe you're not seeing as many feedback responses as you used to. The first question you want to start by asking is, did patients receive the intended message? And so this is kind of an example here. You can look at, this is what you'd see in your board, the message deliverability rate. Say that 3 times fast. And as Michael mentioned, you can get the raw counts here and download them if you need to work with them a little bit more closely. So let's take an example. Let's say your referral conversion has been lower than usual. And you want to see if there are delivery issues more specifically with your inbound referral notifications. So there you'll have a table in your product dashboard where you can look more closely at the type of notification. Maybe you sent out a broadcast message where you were encouraging patients to schedule a mammogram if they were over a certain age or at risk. And you didn't see the uptake in mammogram appointments being scheduled as much as you thought you would. So first thing you'd look at is see if the broadcast message rate looked low, especially for that time period. We'll go into that next, to how you can kind of look more closely at time periods. So what if the delivery rate looks unusually low? So if there seems to be a connection between the delivery rate and the issue you're concerned about, and you'd like to investigate this a little bit further, because there's obviously a ton more metrics that we have access to. We don't want to overwhelm you with these dashboards, but if you are seeing a reason to look further into it, I encourage you as a first step to reach out to Luma support and say, hey, I've noticed that there was a drop in my broadcast delivery rate. And could you see if it was for this specific mammogram broadcast appointment that we sent out? So for example, they can look into that kind of data a little bit more closely. For anything that's more complex, I would recommend reaching out to your CSM, and they can work with the various teams to investigate further. So another way we can look at is measuring the success of those improvements. So let's say that you've implemented a new referral campaign outreach. And kind of we'll get into that too in a little bit in the slide. And you want to look at a time period. So by default, as Michael mentioned, it defaults the last 7 days. But there's a lot of fun things you can do with that data aggregation. So you can change that so that you're looking at a longer time period. Let's say I want to look week over week for the past quarter. So you can go in here. So the creation date range, I can do a custom date range, and that's fuzzy, but I set it up to be January 1 through March 31st. So that being, Q1. And then I want to look at it week over week. And that's when you can go to that next one that's date aggregation and look at it by week. And again, locking those filters is super helpful if that's what you're going to look at all the time. I always want to see my week over week data. That way you don't have to go in each time and change these filters. So I personally do that. I like to have mine looked at week over week, because I go in every Monday morning and look at the past week's data for a lot of my customers. And so also each report that you're looking at is going to have slightly different filters. So just feel free to explore, tick through each one and see what the filters are that are available to you for that type of report. Okay, so let's say that I manage a chain of physical therapy centers. We sent out a marketing campaign to local orthopedic and sports medicine clinics in February, letting them know that they could use our new embedded web form to send us physical therapy referrals. And I want to see if the timing of the campaign coincided with a rise in new inbound referrals for Q1 of this year. So I would change the time period to be January 1 through March 31st, and the date aggregation to get that week over week. And let's say I wanted to see more specifically if the new referrals went out for PT centers on the south side of town. So that's why I can also add that filter for facility to narrow my results and compare them to other practices. And so that's kind of what I've seen here. This is where I've done it for the week over week for Q1. And this is filtered to those specific facilities. And last, we can use it to estimate time savings that we at Luma might be saving from staff time by automating certain features. Also, if you want to estimate return on investment for any financial reports you might need to be generating. So you can gather these data points and use them to estimate these factors. So for example, you can look at completed forms that were previously before Luma completed by staff over the phone with patients. You can look at how many completed and then estimate how much staff time has been saved by using Luma to power your intake forms. So let's say if it takes staff on average 15 minutes to complete an intake phone call, and you had 29 forms completed yesterday, that is a savings of 7.25 hours of staff time. So you can kind of compile those and put those estimates together. Or let's say that I'm a primary care clinic and I've received a grant offer to offer telehealth therapy sessions to low-income patients. And I need to provide this grant reporting. So I want to look at how many telehealth appointments were scheduled in the past 30 days for patients participating in the program. So I can filter the number of telehealth appointments to the last 30 days and use the appointment type filter to only look at telehealth appointments that used the special appointment type that we created for this grant program. And so just using the reports that are available to me in the product, I can come up with those figures and put that in my grant report. All right, so now we're at the Q&A time. So I will open it up and see if anybody has any questions. And feel free to, if you have any questions, put them in the chat, or you can come off mute, whichever you'd like.
Does anyone have any questions for Kristen and Michael? I think we've got a question come in. Is there a report that will tell me the time spent in televisits?
Do we have that on our telehealth report? Do you know, Michael?
I was checking. We have some. Let me just double check here. I don't think we're aggregating on time at the moment. We did build a custom one with that metric though, but I'm not sure we never, but that would be a good addition.
And that's actually brings up a great point too. So these reports are ones that we've put together, but we love hearing feedback. There are some things that are very easy for us to change, some things that might be more complex, but as long as we know what you're interested in seeing and what's a high priority for our customers, then that we'll take all that feedback into account and see how we can build out and improve these dashboards to make sure that they're as useful for you as possible. So if that's some metric that might be useful to you, you can let us know in forums like this, but you can also, you can let your CSM know. And I think we also have a form in the Help Center where you can also submit those ideas. And we really do listen to them, take them in and make changes based on that feedback. So it doesn't just go into the digital ether where nobody pays attention to it.
Thanks, Kristen. We've got another question. Do you have a report on patient responses to specific broadcasts?
Yeah, broadcast is one of those that are difficult to track just because of how our data model is set up. I think we do have a ticket on the backlog to kind of be able to kind of tie a broadcast back to like a response. I think for some of them it's possible. Again, I think we did some custom work for some of the customers to kind of tie them for like these very specific broadcasts, but we haven't done it in a featured available way for everybody.
And I think there's interesting ways too. It depends on what kind of response you're looking for. Like if you're looking for an actual like SMS text response, that's one thing. But one thing I have actually seen some customers do is they'll embed a link in their broadcast message that might take them to a web page that they've set up. But they can, if you have Google Tag Manager, then you can add a tag in there that allows you to track people's activity and interaction with that link and the page that it takes them to. So there's always creative things that you can kind of do with those broadcast messages to check what the response is to that campaign. And again, you can just check in with your CSM and they may be able to add more details.
Have we got any last questions coming in? Otherwise, we can call it a wrap for now. I'll give 30 more seconds. Okay, I think we'll call that a wrap. And big thank you to Michael and Kristen for hosting the office hours. Some great information there. And this will be getting uploaded to the Help Center. So feel free to share with colleagues. And again, we've got the June office hours coming up later that month. So please keep an eye out for an email and sign up for that next time. But yeah, big thanks to Michael and Kristen. Take care, everyone.
Thank you.